everyone. Welcome to the Prioritize the Pause show. I am so excited. We have another guest, Dr. Valerie, who is a dentist. And she, you know what? I'm going to stop trying to introduce her. I'll allow her some time to introduce herself. So, Dr. Valerie, can you just take some time to introduce the audience to you, the type of practice you have, things like that?
Yes. So thank you, first of all, for inviting me. I feel honored. My name is Dr. Valerie Mukanga, and I live in Texas, Dallas, Texas area, more like in Fort Worth. So I have my own practice called Healing Wings Dental, and I'm a general dentist. So there, we see people of any ages, from babies to adult, elderly, any age really, and we just do any kind of general dentistry, just restoring teeth or even missing teeth, or like even also preventative care. So yeah, that's pretty much what we do.
Perfect. Thank you so much. I'm so excited that you're here. And why I brought her on the show today is because a lot of times with our oral health, we just think, oh, let me just use some mouthwash. Let me brush my teeth for 10 seconds and be done. And then we end up with a cavity or need a root canal or something like that. So I really wanted to talk to the audience about the importance of oral care, why we need to take the time every day to pause, do the different things we need to do to be successful, and then what are the benefits from doing that? So, my first question, Dr. Valerie, can you
Yeah.
please tell us what are some of the common things that you see in your dental practice? What are some of the common issues that come up?
Yeah, so you do have a lot of people that do have, gum disease from just lack of brushing. It's so funny because sometimes you see that patient that the teeth are squeaky clean, but once you start cleaning, it's bleeding all over. It's because they just kind of like brushed before they came. But I mean, you can't really trick the dentist, like we end up finding out what's really going on. But yeah, so besides that, people have, cavities, things like that as well, that we commonly see. I am I often find, this patient that would say, oh, doctor, I don't have any problem. I don't have any cavities. My mouth is good. I have no problem. But it's like, those kind of patients, when you go, you check them, yeah, sometimes, you find the ones that don't actually have cavities, but they do have gum disease. They do have bone loss. They do have, bleeding gums, swollen gums, and things like that. And they don't realize that, that's very detrimental for their health. So yeah, that's what we commonly find. Just like people are not very aware of, the benefits of actually getting their oral health on point.
Yeah, absolutely. And honestly, sometimes for people, it's barriers. Like for me with my oral health, I didn't really go to the dentist until I was in residency. As growing up, I never really got a chance to go. But in
Yeah,
residency, I finally had like a root canal. I mean, I guess a tooth that was really just messed up and I needed a root canal. And I said,
correct.
you know what? I can't keep playing these games. I
Yeah.
can't like keep saying that, oh, I'll do it later or it'll be fine or take antibiotics for it. No, I had to prioritize my time and really like establish with the dentist and get cleanings. So actually, what's the other question is, how often should somebody come to the dentist? And then a follow-up question for that, can you talk about what would be a really good just oral care routine for someone to do every day?
Okay. Yeah. So commonly it's requested, to go see your dentist twice a year. Because during that time you have built up enough plaque that it becomes hard for you to just remove it with your toothbrush. However, if it's somebody that has gum disease, and depending on the level, of the disease, it might be recommended to come every 3 months. So yeah, that's pretty much like the recommendations. But as far as like your routine care, you do definitely want to brush your teeth at least twice a day, morning and night. Night is very important because some people brush just once a day, and then at night it just collapse. But see, at night actually you have a decreased salivary flow, so your saliva decreases, but your saliva allows you to be protected some from the bacteria that attack your teeth. That's why when you see people that have dry mouth, it's easier for them to get cavities and to have other type of problems. So it's very, very important to brush at night, because since your saliva flow is going to decrease, at least, you know, you have actually reduced the bacterial load. And so that helps you out, you know, for decreasing, you know, the effect of the bacteria that damage your teeth at night. So it's very important to brush in the morning and also at night. But besides that, that's not the only thing. You also want to floss. The reason why you want to floss your teeth at least once a day is because the bristles of your toothbrush, they are too thick. Even though they look small, they don't go between your teeth. So if you don't brush, I mean, you may brush very well, but if you don't actually remove the particles that go between your teeth, you know, then you can start developing cavities there, and also, you know, gum disease. So you want to at least brush once a day. I mean, floss once a day, and go see a doctor every 6 months. You want to use toothpaste that have fluoride, because the fluoride will protect your teeth as well. And those are some of the things. You know, you can use mouthwash. Some people like to also use like a water pick. That really helps a lot, but it doesn't necessarily, you know, take the space of the place of your dental floss. You can do both. You can do all of it. Yeah. So yeah.
Mm.
Yeah.
Well, you taught this girl something today about the brush. I mean, I brush at night most nights. Sometimes I'm lazy and I'm like, oh, I'll just do some mouthwash and be
Right.
done with it. But no, like, you know what? I can see that with the brushing at night. And I definitely will start making that something I do regularly. And then flossing, now I'm gonna have to pray to the Lord for my consistency with flossing. But I know it's a area where I want to work on, so that flossing part is good too.
There's a lot of like, we see a lot of kids, right? So sometimes you see kids, you know, you look at the surfaces of their teeth and they're really clean, but you know, you see so many cavities between the teeth. And it's
Yeah.
like, what happened? And it's like, because you're not flossing. So maybe what you want to do, perhaps you can say, okay, after you have eaten your last meal, then you're gonna floss, you know. Maybe you can floss even while you're watching TV. Just try to kind of like, you know, fit it in there. It's very important.
Yeah, I actually
And you
like
know,
that flossing while watching TV. I might have to do that because I have the little floss
right, the
sticks.
flossers,
Yeah.
right. And then there's another thing that you said, right, Dr. Tanya, you talked about some people just think they can just brush 10 seconds. But what if you really, like, which surface have you actually brushed in 10 seconds? It's recommended to brush about 2 minutes. So the
Mm.
happy birthday song, happy birthday to you can sing it twice and you have actually done 2 minutes about. So yeah, those are some of the tricks. But you know,
Ooh,
they
I
also
like
have
that.
toothbrushes that have timers, and that will show you, you know, let you know if or show you, you know, how heavily you're brushing, or you know, all of that. About how if heavily you're brushing, you want to use like a soft bristle toothbrush. Some people think that the harder the bristles are, the better they will brush, but it can start like removing some part of your enamel, and also like damaging your gum to where you can start having recession. So yeah, you want to be mindful. Soft bristle toothbrush.
Goodness, again, another thing, the soft bristle. I really thought like I was a medium bristle person for a long time. And I think someone said something about soft. And I'm like, I don't know. But then I switched over to, I think it's called Quip, the one they send you a brush head automatically and it was always soft. So I was like, okay, whatever, I'll do that. And I
Mhm.
also like you mentioning the timer and the time actually limit of how long we need to brush for the 2 minutes. I have a toothbrush that every 30 seconds it vibrates and then it cuts off at 2 minutes. And I was
Mm.
realizing when I first got it, I would be brushing for a good 45 seconds. And after I was like, why am I still brushing my teeth? Okay, because I'm supposed to be brushing it for 2 minutes. And it was honestly that timer. It's the only reason that I know about the whole 2 minutes because it vibrates those 4 or 3 times and then cuts off.
Mhm. Yeah, so you want to brush the outside surface of your teeth that's close to your cheek, the inside close to your tongue, the chewing surface. You also want to brush your tongue because you have some, particle that stay on your tongue can increase bad breath, even the roof of your palate and the side of your cheek. Yeah, so all of that amount to the time, right?
I know, it's actually not bad. I feel like what you're telling me is just so essential, and we're telling us really, not just talking to me, us. It's so essential, but it's like those little lessons that we forget.
Mm-hmm.
Like the brushing for the 2 minutes, the flossing, even flossing. Like I feel like I can just move my flossers to the living room and I would have a better chance of flossing if I did that in the living room or
Yeah.
doing the birthday song, like having that birthday song in my head or just some other song. I could just play a song, any song. It's
Come
a
on. Yeah, why not?
song. Or set a timer or do something like that. I know at one point I was doing my gratitude practice while I was brushing my teeth. So I'll brush my
Mhm.
teeth for the 2 minutes and then I'll be thinking, okay, what are some things that I'm grateful for? So it was my
Right,
way of kind of letting my mind wander and I wouldn't stop at well, after 30 seconds, I would keep going. So there's
right.
several ways of incorporating, increasing or improving the oral health. I do have
Mhm.
another question.
Go ahead.
What is your preferred toothbrush? I know we talked about having the soft bristles, but do you have like a toothbrush that you recommend to people?
Well, a toothbrush, like I would say, as long as it's a soft bristle, it's good. Um, Electric toothbrushes are also very good. Like Sonicare is a brand that's really high end there. Um, yeah, but like as far as that would be with the toothbrush, because you would have to do less work. It does a lot of work for you. So, you'll do a better job, I think, with like an electric toothbrush. But as far as toothpaste, now I'm gonna go on the toothpaste. You want to actually use, toothpaste that does have fluoride, except for if it's a baby, that because they can't swallow. And swallowing the fluoride can actually start upsetting your stomach. So you want to be mindful if you have a baby. But you do want to use like a toothpaste that is ADA, that has the ADA seal, which is the American Dental Association, because it's been approved by the association. So yeah, that's the recommendation.
Ooh, another good tip. I didn't even think about one having the seal and then thinking about children with, well, like babies with brushing their teeth and just being mindful of the fluoride and all that. Wow. You've
Yeah,
given us so much information.
yeah, it's important for for parents to brush their babies' teeth, because they can end up, if you don't, you think that they're not eating any sweets, but even children who are breastfed, they can develop caries called baby decay. And so because even with the milk, there's enough sugar for that to start damaging. In fact, there was a family member of mine as a baby that had that issue. It's when I was in dental school. I was like, oh, that's what it was.
Mm,
Yeah, yeah. So, mhm.
wow. This was so good. Do you have any like advice or anything you want to leave the audience with before we end?
Yeah. So, I wanted to say, taking care of your oral health, it also helps as far as your mental health. It
Yeah.
decreases your anxiety because, say, for example, you are suffering from bad breath, or maybe you have lost a tooth. Now, all of a sudden, in front of people, you don't really want to be your best self. You're kind of hiding. When you laugh, you're kind of covering your mouth and things like that. So we can help you, even if, you have lost teeth. Teeth can be replaced. There's so many different ways that they can be replaced. But another thing is many people, they especially parents, they just focus on taking care of their children. In fact, I had a patient like that today, and finally she came, thank God, but she had so many cavities and lost so many teeth. So prioritize yourself because it's important. And I wanted to leave you with a little story of my uncle, though. He had because there's a correlation between oral health and the rest of your body, overall health. I mean, it's a non-brainer for some, but for some maybe not. So what happened to him is that he had a cavity, and then he did not go to the dentist, probably because of lack of fund. That was back home in Congo, since I'm from Congo, the Democratic Republic of Congo. But anyway, so he actually ended up going to the dentist, and it was late though, but that same day he ended up having a stroke, and he did pass. Yes, ma'am, he did pass. So, you know, it can end up being tragic as far as like not taking care of your teeth. I would really recommend, because if you think about it, the same bloodstream that has the infection, carrying the infection from your teeth, is traveling all the way down to your heart, is traveling all the way down to your brain. You know, you can end up having a heart attack or infection at the level of your blood, all sorts of issues, you know. So yeah, I would recommend just really try to prioritize oral health. It's very, very, very important.
Oh, Dr. Valerie, one, I'm so sorry about your uncle, and thank you for being open and vulnerable and sharing that story with us. And honestly, you have given us so much good information. Just the importance of the oral health. I know when I was seeing patients, primary care patients full time, I would have
Mhm.
people coming in all the time with like having these big abscesses in their
I know.
mouth and all these different things. And as a primary care doctor, I'm somewhat limited in my ability to really care for them and serve them. Of course, antibiotics, we can do different pain medications, but I kept telling them, you have got to see a dentist. There's only
Exactly.
so much I can do, but you have to, as much as all these times you keep coming in to see me, we got to get you established with a dentist. It is
Yeah,
so, so important. Your oral health is so important. And even when you mention about people's self-esteem and their mental health and wanting to show up, we as people, just in general, any person, one of the steps of success is being able to present yourself. And
it
if
is true.
someone is feeling self-conscious about their mouth and their teeth, look, my mouth is showing the whole time. Like you're gonna not show up, you're gonna feel kind of sad and defeated. Keep yourself in this small box because you're not confident about your mouth and your teeth or your breath or something like that. So
That's right.
having the practices that you discussed, brushing your teeth for 2 minutes, flossing once a day, making sure you see a dentist twice a month or maybe
Twice
every
a
6
year.
months. Yeah, Lord,
Twice
thank
a
you.
year.
Twice a year or every 3 months, depending on if you have like gum disease.
Right.
It's so important. Those are some things that we can do consistently to help improve our health so we can show up and do the different things we want to do with confidence.
Right. You're right.
Ugh. Dr. Valerie, so I know you said before you're in Texas. Tell us again where people can find you, where they can connect with you online, everything you want to share.
Yeah, so we can be found in Arlington, Texas at Healing Wings Dental. Our website is healingwingsdental.com, and the phone number is 972-213-0202. We are also found on social media. We have an Instagram page and also a Facebook page. If you type Healing Wings Dental, it should pop up.
Dr. Valerie, thank you so, so much. I appreciate you. And everyone should appreciate you. But like the tips you gave are solid gold tips that can help people in ways that I didn't even think of when we talked about having this conversation. The confidence, the improving, I mean, I kind of thought about improving the health, but the improving the health, if y'all are in Arlington, Texas, go on over there and get your teeth, have your whole oral health cared for by Dr. Valerie and her team. She will take care of you and really set you in the right path as far as your oral health. All right, thank
Thank
you
you
so
so
much.
much. Thank you, Dr. Tanya, for having me tonight. I
Yes,
appreciate it.
of
Have a
course.
great day.
You too. Bye, everybody.
Bye.